Hello, my name is Fintan Hourihans. I'm the Chief Executive of the Irish Dental Association. I want to talk to you today about the concerns of dentists in Ireland about the provision of dental care, access to dental care for all our community. We recently made the following presentation to an assembly of Oireachtas TDs and senators. I was joined at that meeting by a number of colleagues, including Dr. Caroline Robbins, Dr. Raymond Croke, Dr. Will Reimer, Dr. Maura Cuff, Ms. Roisin Farrelly. We began by talking about why oral health matters. Oral and dental health form an essential part of general health and well-being. Oral diseases also share common risk factors with chronic diseases such as heart disease, obesity, and diabetes. Our experience to date is that oral health isn't prioritized in terms of promotion, funding, or service delivery. Diseases of the mouth and the oral cavity have a significant impact in terms of pain, suffering, impairment of function, and reduced quality of life. To a large extent, oral diseases are entirely preventable, yet when they occur, the damage is not reversible, and they can be among the most expensive to treat. From an economic perspective, for oral health, we need to look at both direct costs, the treatment costs, indirect costs such as productivity when you're missing from school or work, but also the intangible costs in terms of the detrimental impact on people's quality of life. From the diagram, you'll see that for treatment expenditure alone, dental diseases in the EU 28 amounted to treatment costs of approximately 92 billion and productivity losses of 52 billion. Dental expenditures are substantial, both in absolute and relative terms, especially when you consider other health diseases which are listed on the slide. It's also important to note that over 80% of expenditure on dental care in Ireland is out-of-pocket expenditure, according to the CSO. So that shows that state assistance toward the cost of dental care is extremely limited compared with other health conditions. It also shows that oral health is very strongly linked to socioeconomic status. The approach to prevention and treatment of oral and general healthcare diseases should be closely connected. It should be achieved through individual, professional, and community level approaches. As with most disease, prevention is key. Investment in timely and effective oral health results in the enhancement of general health, better quality of life for patients, and a reduction in the financial burden on healthcare systems. Where investment is low, resources are primarily allocated to emergency oral care and pain relief, and underprivileged groups are amongst the most vulnerable in those circumstances. Across the life cycle, oral diseases and conditions disproportionately affect the poor and vulnerable members of our society. Last year, the WHO World Health Assembly adopted a resolution on oral health and asked the Director General to develop, in consultation with member states, a draft global strategy on tackling oral diseases. This requires member state governments, including Ireland, to develop a concerted plan to integrate oral health into general health policies and to develop specific initiatives to address the many problems in oral health. As part of its rationale, the WHO Assembly said there's strong and consistent association between socioeconomic status and the prevalence and severity of oral diseases and conditions. One of the key issues we want to discuss is dental workforce and capacity in Ireland. The staffing and resourcing within the dental sector is the single biggest issue currently facing dentists and their patients in Ireland today. Access to dental care is in crisis right now, and it requires urgent intervention. As a representative body, we've heard from our members for a number of years across the public and private sector. They're encountering increasing difficulty in recruiting dental team members, including dentists, dental hygienists, and dental nurses. The issue is gaining increasing prominence and is having a real impact on our members' ability to run their clinics efficiently and on the patient's ability to access vital healthcare. A report completed as part of the National Oral Health Policy found that in 2016, there were 45 practicing dentists per 100,000 in Ireland. And at the time, that put us at the bottom quintile of OECD countries. However, since then, we believe the situation has deteriorated further, and the number of practicing dentists per head of population has further fallen. In the private sector, our data shows that the majority of vacancies cannot be filled. In September of this year, we surveyed our members who reported that 2/3 of practices who tried to recruit dentists over the previous 12 months couldn't fill the vacancy due to a shortage of candidates. Half of the practices who attempted to recruit dental nurses or hygienists couldn't find a candidate. This situation is not sustainable. In terms of the impact on access to dental care, 2/3 of dentists who responded to the survey said the staffing shortage is having an impact on access to dental care. About 2/3 said that their capacity to treat emergency appointments has fallen over the past year. 3/4 of dentists said that their practice could open for longer hours and provide more appointments if more staff were available. In the public service, we've consistently highlighted the staffing crisis. This is a service which provides care to children, special care patients, and orthodontic care. In November 2017, we carried out a survey of HSE principal dental surgeons. Nearly all of those who had responded had sought to recruit dentists in their area over the previous 5 years. Of these, over half had experienced problems failing to attract suitable candidates, and 3/4 said that there were less suitable candidates than had been the case 5 years previously. There can be no doubt but that there are severe recruitment and retention issues for the public dental sector, largely arising from public policy decisions which have reflected a very low priority being shown to properly staffing this sector. HSE figures show that there were 330 whole-time equivalents employed by the service in 2006. However, by December of 2021, this figure had fallen by 24% to 252. This has happened at a time when the under 16 population has increased by 20% to 1.1 million. So, as the population of eligible patients has increased by 20%, the number of dentists working in the HSE to treat those patients has fallen by 24%. Earlier this year, the Minister for Health announced that there was a need for a specific workforce plan for oral health to develop a dental workforce plan. We welcome this, and we believe that work on this needs to begin urgently, and the government needs to engage with the Irish Dental Association to address the staffing crisis. We've put forward a number of solutions to deal with this problem, including the reinstatement of a foundation training scheme, a significant number of places for undergraduates in our 2 dental schools. The numbers of places have fallen drastically in the last number of years when you take account of the fact that half of the places are taken up by students from far away who, in the main, tend to return to practice in their homeland. And that means that we have fewer places available for students from Irish schools who are more likely to work here in Ireland. We also need to see reform of the work permit scheme for dentists. We need to see more places also for dental nurses and hygienists. If we look at what this means in terms of care for adults, we all appreciate that there is a growing awareness of the problems with the medical card scheme, which is designed to provide care for 1.5 million adults. We can see clearly from this graph that the number of dentists participating in the scheme has fallen markedly from over 1,800 in 2015 to barely 1,100 earlier this year. In fact, we believe that there are barely 600 dentists actively treating and claiming payment for treating patients at this moment in time. There has been a significant reduction in the number of dentists participating in the scheme If we look at the figures between 2017 and 2021, we're seeing large reductions in Dublin, in Kerry, in Wicklow, Laois Offaly. You can see the figures, they're on the screen. If we look then at what that means in the numbers of people treated and the number of treatments provided, we can see that in 2021, there was nearly half of the treatments provided that would have been provided in 2014. If we look at the number of patients, whereas over 436,000 were treated in 2014, it was down to 264,000 in 2021. There should be no doubt, dentists do want to see a state-funded scheme to help improve access for lower income groups. We asked dentists as to their plans for the next couple of years. The vast majority have said they do not want to be operating in the current DTSS scheme. 99% of the dentists say they don't believe that that current scheme allows them to provide the appropriate level of care. There's a lot of bureaucracy, a lot of restrictions on the treatments they can provide. It's just simply not in keeping with best dental practice. In the same vein, 98% of dentists said they can't provide an appropriate level of care to medical care patients to the same high standard they provide to their private patients. And not surprisingly, there was huge dissatisfaction with the lack of referral pathways for patients requiring urgent care. So what needs to be done? We need to see an immediate start on discussions on a scheme to replace the DTSS for medical care patients. There have not been any discussions. There have been talks about talks, but there has been no commencement of formal discussions on a scheme. We also believe that the previous tax relief available on the cost of dental care, where marginal rate relief was available, should be provided to benefit all adults. And not surprisingly, we feel it's critically important that clinical care pathways must be established where specialist care is needed. Turning to dental care for children, we're aware that children should have their first dental examination by their first birthday. And while this may not yet be the norm, the latest figures from the HSE Public Dental Service are truly shocking. Since 1994, official policy has been that primary school children should have a checkup through the school-based dental screening service in 2nd, 4th, and 6th class. However, remembering the fact that we have so few dentists in the HSE, the reality is that most children are only seen once in primary school. That tends to be in 6th class. We've come across cases, however, in Offaly, where it takes until 2nd year in secondary school, and in Laois, where it takes until 4th year in secondary school before screenings take place. This is simply far too late. Again, if we look at the impact this has in Laois Offaly, we can see that as recently as 2016, the service was operating on the basis of extracting teeth to a far greater extent than saving teeth with the provision of fillings. And that's replicated across the country. It's also important to remember that there are significant waiting lists for children requiring treatment under general anaesthetic, and in terms of people on acute hospital lists for oral surgery and maxillofacial surgery. All of these alarming figures reflect the fact that the service has been grossly understaffed for many years. In fact, it would take the employment of an additional 76 dentists to get us back to the level we were at 15 years ago. It's also important for us to say at this stage that the profession does not support the notion of contracting out or outsourcing the current children's screening service, which is supposed to be provided by the public service. There isn't the capacity in the private sector, but equally we believe strongly that the expertise, the resources, and the time required clearly indicate that the state dental screening service should continue to be provided by the HSE. We're also aware that the government is keen to have a scheme rolled out for the provision of care to children under 7, and suggesting that this will happen and be provided by private dentists. We've surveyed dentists previously or recently. The overwhelming majority, 3 in 4, just don't see that this is possible. So what needs to happen? We need to see more staff employed in the public service. We need to see the end to the uncertainty over the future of the public dental service. We need to see specific initiatives such as the recommendations in the National Clinical Programme for Paediatrics and Neonatology, for children requiring treatment under general anaesthesia. And we also need to see new ideas in tackling the orthodontic waiting lists, including providing support towards the cost of private dental care for children. Finally, we want to say that it's very important that we have appropriate safeguards in place to protect patients. The legislation governing the practice and regulation of dentistry dates back to 1985. All other health professions have had their legislation updated. We need to see urgent attention paid to reforming dental legislation in the interest of patient safety. The regulatory body, the Dental Council, has provided a detailed submission which we fully support. We want to see this prioritised as a piece of legislative reform, and we ask for your help. Much more detail on our plans and our diagnosis of the problem, what needs to be done, can be found in our pre-budget submission, and that's available on our website, www.dentist.ie. Thank you very much.